Chapter 9, Obstetrics and Neonatology. In the first part of Chapter 9, we're going to pronounce organs and anatomical structures relating to pregnancy and define and spell word parts related to obstetrics and neonatology. We're also going to define, pronounce, and spell disease and disorder terms and surgical and diagnostic terms. In the previous chapter, we looked at some different anatomical organs and structures of the female reproductive system, but we're going to look at it now that based pretty much entirely on as it relates to pregnancy and the fertilization and implantation process as well. So it begins with the ovary and the ovum, and once ovulation happens, then the ovum or the egg is released from the ovary and it travels into the fallopian tube where it's sterilized or fertilized, and then passes on down. At this phase, early phase, is referred to as a zygote, and it moves on into the uterus where at some point in here it will connect to the uterine wall and begin to grow from there. And of course, the other structures that we consider is the cervix and the vagina, which become even more critical as you get into the actual birthing process. The fundus is the upper portion of the uterus. Once the fertilized egg moves into the uterus, and you can see the buildup of the wall of the uterus in order to support the developing placenta and fetus, it attaches to the wall, and you have the umbilical cord that extends out into the umbilical area of the fetus, and it continues to grow there and develops and gets its nourishment through that umbilical cord and uterine wall until time of birth. Common combining terms include amnio or amniano, and that means amnion or amniotic fluid. Feta or feto, and in the I or the O, either one may be used, refers to fetus or unborn offspring, and lacto means milk, and umphalo means umbilicus or navel. Some other examples include cephalo, which means head, episio, which means vulva, primo is first, and in this case the combining vowel is not an O but an I. Pyloro means pylorus or pyloric sphincter, and tetro is malformation. Common suffixes include cysis, which is pregnancy, genic, which means producing, originating, or causing, rhexis, which means rupture, stenosis, which means constriction or narrowing, or tosha, which means birth or labor. In this example listing, there are both terms that are built from word parts and terms that are not built from word parts. So if you take a quick look at these, you may be able to tell for the most part which are which, but abruptoplacenta means the premature separation of the placenta from the anterior wall of the uterus. So that one is not built from word parts. Dystocia is, can we find word parts in this one? Yes, we can. Dys means difficult, and the totia means labor, so this is difficult labor. Placenta previa is an abnormally low implantation of the placenta on the uterine wall that is completely or partially covering the cervix. This one is, of course, not built from word parts because it doesn't define specifically. Polyhydramnios. Poly means much or many. Hydro means water. Um, so we are much amniotic, and hydra, and then amnios means amniotic. So much amniotic water, or an abnormal amount of amniotic water. Pseudoclesis. Clesis means pregnancy. Pseudo means false. This is a false pregnancy. So the first and the third are terms that are not built from word parts. The other three are terms that are built from word parts. Examples of terms, again, built and not built from word parts. The first being congenital cytomegalovirus infection. This is abbreviation CMV is common. It is a herpes-like virus that crosses the placenta, and in the newborn, it can cause jaundice, microencephaly, in this case, a abnormally small head, a developmental delay, and hearing loss. In some cases, the infant may be non-symptomatic. Erythroblastosis fetalis is a condition where the newborn has hemolysis of the erythrocytes of the red blood cells, usually caused by an incompatibility between the mother's and the infant's blood. And this happens whenever, or is a potential of happening whenever the mother has an Rh negative blood type and the baby has an Rh positive blood type. Esophageal atresia is a congenital problem where part of the esophagus is missing and food can't pass down into the stomach because of this missing part. Respiratory distress syndrome is a respiratory complication in a newborn. Usually, the newborn is premature. It causes a problem in the respiratory system, which causes the respirations to be compromised. Pyloric stenosis is a narrowing of the pyloric sphincter. And just to mention, stenosis can be used as a suffix, or it can be used as a standalone word, as in this case.